Hey guys, my name is Matt and I'm coming to you from Chicago at the tail end of a 14-day quarantine, self-imposed quarantine, after I took my family from Ningbo, China, which is south of Shanghai, to the United States as this coronavirus started to accelerate closures of airports and flights, and it started getting quite tight. So I made the decision, and we all agreed as a family to come to the United States and sweat this thing out. If you don't know, I'm a traveling YouTuber, so I do make videos about my life as I travel on the road. And so while this coronavirus, or COVID-19 as it's being called, is sort of affecting my life right now, I've decided to shift the focus of my channel to deliver information about the virus that I'm gathering directly from China, friends and family over there, from the news and whatnot, because it's really affecting my life and the life of my family and loved ones. And so I'm taking a really piqued interest in it, and so I feel like I'm sitting center stage at a horrible performance in human history. And the performance had sort of a crescendo the other day as the statistics on the virus gave us a booming number of over 15,000 confirmed cases and 250 deaths, like instantly. The lead up to this is very interesting. The reasons for it are also very interesting, so I want to break it down for you because I've been doing a lot of research about it for the last day. When this came in, both me and my wife were checking the statistics. Typically, they update maybe once or twice, maybe 3 times a day. The update for the amount of cases had been delayed, and so we were checking because we were wondering, is this thing tapering off or is it getting worse, and what's the news? Now, if you looked at the chart from the Johns Hopkins University or any other statistical graphic website that's kind of keeping tabs on the virus, you'll see that the days prior to this big bump, it was starting to sort of taper off. I was apprehensive about it because I knew that from the reports I was getting in China and from my friends in China, people weren't getting admitted to hospitals because they were at capacity, so they weren't getting checked and verified, and so they weren't being confirmed and added to the statistics. People weren't getting tested by the test kits that were required to test for the coronavirus, COVID-19, because simply places were running out of test kits. So if you don't have the test kit, you can't confirm, and if you can't confirm, you're not a statistic. And then I also don't have a lot of faith in the system over there in China itself to maintain accurate numbers. So those 3 factors had me not really confident that whatever was coming out there was true, and if there was a taper, I felt like it was coming a little bit too early for this thing to start really wearing down. I feel like this virus has a few more surprises up its sleeve. We don't need to be too overly confident in our battle towards it. We just need to be smart. Last night at around 9 o'clock, the system finally updated. And when it updated, it went from this taper to a vertical shot that validated 15,000 plus confirmed cases. As of today, right now, let's just do the statistics. There are 60,364 confirmed cases. This is up from the day before by 15,181. To give you some context, the previous highest increase was February 4th, when they had 4,000 new cases. So 4,000 new cases, 15,181 cases, a huge bump. The history behind it is quite interesting, and I was very confused at it. My wife was not confused. She was saying that the news coming out of China was predicting that there was going to be a correction, that these numbers were going to increase, but she didn't know how much and she didn't know when. A lot of pieces on the puzzle in China were moved last night and in the last few days, probably since Tuesday. I'm recording this video on Thursday, February 13th. Let's go farthest back, okay? So the farthest back, you had a gentleman called Wang Hesheng who replaced 2 high-ranking Wuhan Provincial Health Commission representatives. These were very high-ranking people that were in the Provincial Health Commission in Wuhan. The director and Communist Party secretary of Hubei's Provincial Health Committee were removed, state broadcaster China Central Television reported Tuesday, making them the highest-level officials known to be punished for the government's handling of the outbreak. Both were succeeded by Wang, Hesheng, deputy commissioner of the National Health Commission, and a veteran health official who has been responsible for China's healthcare overhaul and medical administration, according to the commission's website. So this is like the first die that was cast. These numbers are increasing, things are happening, and China kind of, the overall Beijing, China, let's just say Beijing, the official Communist Party entity kind of comes in and says, let's shake this thing up. I'll get into my suspicions and overall theories on this and what happened, but first let's just talk about what happened, because there's a lot more. So, the next thing that happened, Chen Yixin came in. Now, he wasn't replacing anybody. He was simply flown into Hebei last week. Last week, it dispatched Chen Yixin, the former Wuhan Communist Party chief who was serving as Secretary General of the party's powerful Central Political and Legal Affairs Committee, and who is regarded as being a close friend of Mr. Xi Jinping, assigned to Wuhan to serve as the deputy head of Central Guidance Team. The team is supervising local government's work in epidemic prevention and control. All of the articles I referenced said that he was a law enforcement heavyweight. And I think that his move was basically born on the back of the death of Li Wenliang, who was the original, let's just say, whistleblower on how nasty this virus was going to be. And unfortunately, his voice was suppressed by the high-ups in the Wuhan government. So they pulled this guy in who has a history in Wuhan, and they brought him back. And I feel like his objective is to wrestle some control over the messaging of this whole thing. I feel like labeling him a law enforcement heavyweight, that reads to me as somebody who's going to go in there and sort of like make sure that the news coming out to the world about this situation is going to be a little bit more filtered. So that's just my prediction. So the numbers come in, they're a lot higher, everybody freaks out, and they instantly sack a few really important individuals in Wuhan and Hebei. Wang Zhonglin replaced Ma Guoqiang. Wang Zhonglin has been appointed secretary of the Wuhan Municipal Community of the Communist Party in China and member of the standing committee of the Hubei Provincial Committee of the CPC, replacing Ma Guoqiang. Wang Zhonglin is out and Ma Guoqiang is in. The more notable of the shakeup that happened yesterday was the mayor of Shanghai, Ying, is replacing Jiang Chaoliang. Jiang Chaoliang, the party secretary of Hubei province, is the highest-ranking official and was fired. Mr. Jiang will be replaced by Shanghai Mayor Yong. So the party secretary of Hubei province is a huge position. Hubei province it's like the conglomeration of 5 American states. It's a big area. Now, he's a friend of Xi Jinping. Like, they were actually serving in the Zhejiang party together. Zhejiang is the province that I was living in Ningbo. So Ningbo is part of Zhejiang province. And so him and Xi were tight for about 5 years. I think it was just understandable that he probably called on his friend Yong and said, Yong, you got to get in there. I'm going to get rid of Jiang Chaoliang, and you're going to go in. You're going to have to fix this problem. So that happened yesterday. The reason that I think that this is all strange is because there was no prep for this. There was no prompting that this was coming up the pipe. Annie, my wife, she was hearing some things from within China, but all the news was saying was that this thing looks like it's about to plateau. You had the WHO that put out a statement.
The number of newly confirmed cases reported from China has stabilized over the past week. But that must be interpreted with extreme caution.
And you had a lot of news media that was saying that this thing is looking like it's going to be improving. As a matter of fact, Wall Street Journal reports Zhonglin, head of the National Health Commission Task Force on the virus, has sought in recent days to alleviate public fears by saying the outbreak may peak before March. On Wednesday, just hours before Hebei health authorities announced their new numbers, China's official Xinhua news agency touted a drop of the number of daily new confirmed cases. Xinhua noted that it had steadily fallen from nearly 4,000 on February 4th to just over 2,000 on Tuesday, citing National Health Commission data. So they're kind of saying, hey, this thing's, we're getting better and better. Less cases confirmed, we're doing all right. Meanwhile, test kits are knowing to run out, people are being turned away from hospitals, and people are simply not being able to get diagnosed properly. I'm very used to China saying and twisting information and speaking in hyperbole, but this just seems excessive. Even Xi Jinping on Wednesday, just yesterday, was chairing a meeting of the Politburo Standing Committee, China's like supreme political body, and said on the latest development there had been positive changes and positive results. That does not sound like something Xi Jinping would be saying if he knew that there was going to be a 15,000 case correction coming up the pipe. It seems very odd. And in that meeting, he was talking about how everybody's going to be going back to work. His plan before the virus even started the outbreak was to say that in 2020, we're going to eradicate poverty in China. So that was his mission. So this whole thing, the whole virus situation, even if it was to stop in a month, let's just say, let China's normal in a month, which isn't going to happen, but let's just say, the ripples from China being locked off, factories being closed, businesses being scuttled, logistics is being just paused, is going to have a reverberation effect around the world that is going to be pretty hard to comprehend. I am really curious to see all the positive responses. Even Steve Mnuchin, he said that
the corona and the Boeing is just a one-time. When we did the projections, they were back.
What does that
in
mean,
October.
one time?
It's just a one. It'll just impact 2020. So the coronavirus isn't going to impact growth over the next 10 years. It may have an impact on 1 year.
So we hope the coronavirus doesn't have an impact beyond this year. Is that what you're saying?
I don't expect that the coronavirus will have an impact beyond this year.
And that just doesn't make any sense to me, that he thinks that within a year this whole outbreak thing isn't going to matter. I think he's not thinking forward enough, or he's not thinking, or he's lying. Okay, let's talk about why these 15,000 new cases came out. There is generous information to say why it's happened. It's not like 15,000 new cases happened yesterday. As a matter of fact, according to the Wall Street Journal, the vast majority of Thursday's newly confirmed cases, which amounts to about 13,332 of the 15,000, were old cases that had been reevaluated. They were quote-unquote retroactively reclassified. So it's not like all of these 15,000 came out of nowhere. I'm not saying that. But I am saying that this is a big number to be reclassified. This is new cases that are popping up on the map, whether they're old cases that they've made a decision on, or whether they're new, they're now on the map. If you take out that 13,332 number and then minus it from the increase that happened yesterday, you still get a number of 1,849 new cases. Those are the new cases, which is below the peak of 4,000 on February 4th, but is still a big number of new cases. So basically what they're saying now is the test kits that were ordinarily the end-all be-all. You didn't have coronavirus until this test kit told you you had it. They changed the policy, and they started using CT scans in order to prove that people had coronavirus. Now, I did a lot of research, as much as I could possibly do. I am no scientist, but I did do some research. I looked at the Radiology trade magazine, which reported on the effectiveness of CT scans. And there was a whole report that I'm going to share below in the comment section. I have a lot of links below that you guys can reference if you want. And this was talking about the validity of CT reports on diagnosing coronavirus or COVID-19. And from what I could gather, it wasn't 100% accurate. There were a few cases that in this original report that they filed that it wasn't like an end-all be-all. The test kit combined with the CT scan was the most accurate way. But a lot of cases could be 100% verified with a CT scan. And when you go to a Chinese hospital, which I have, when you get a CT scan, all of those CT scans are stored digitally on a database. They're evaluated and stored immediately by some sort of in-house surgeon or doctor who has a knowledge in the lungs or whatever. In this case, it's the lungs looking for this kind of telltale pneumonia that comes with the COVID-19 virus. So they had this huge backlog of all these CT scans. They had all of these people that were waiting for diagnoses, and they had a lack of test kits. And they didn't have justification or the thumbs up go-ahead from the central government or the local officials to say you can use a CT scan in lieu of having these test kits. And what was happening was all these people who were not diagnosed properly or weren't diagnosed yet were going without care, they were dying, and they were being sort of ostracized by the community on a social aspect. I mean, they were coughing and exhibiting symptoms. They all had this coronavirus, but the hospital wasn't telling them they had coronavirus, and so they were sort of had the mark on them, you know? Yeah, so now with the CT scans being used as a diagnosis tool, they were able to go through and find these 13,000 old cases, reevaluate all of it. Could you imagine 13,000? Part of me feels like just to go through 13,000 cases must take a considerable amount of time. The fact that they were able to go through and then find new cases, it's good that people who knew that they were sick, knew they probably had this thing, finally can get the care that they so desperately need. I'm sure that there was a lot of people that died who could have probably been put under care, but instead were wrapped up in red tape. On top of all of these cases, you have the people that are unfortunate souls who have totally fallen off the map. People that have been turned away by the hospital, got no beds, got to go home. Those people might not be tracked as efficiently. And the people that get it and die in their homes, nobody hears from them. So there's still a number of people that we might never hear about. On top of that, there's potentially a lot of people that are being covered up by the government, and no one's ever going to hear about them anyways because the government's trying to control the amount of people that are being reported as dying and getting diagnosed. And in response to a lot of this stuff, people have been reacting globally. The US airlines have canceled all flights to China and restricted even more flights all over Asia. So now everything is being pushed to April. It also gives me pause to think about how big this thing truly is inside China. China is a powerhouse. China is huge. I was talking with my friend yesterday, and he was saying that there is no way that China is going to shut down for an epidemic that isn't anything less than cataclysmic. And it gave me pause. You know, China is pursuing growth. They are ruthless at the pursuit of growth. And to have them shut the whole country down like this on such a scale. Now, one of the things Xi Jinping has been touting is that people need to go back to work. As a matter of fact, according to the Wall Street Journal, they say, after the outbreak disrupted the Lunar New Year travel period in January, stranding some people away from their workplaces, 160 million people are expected to travel between Tuesday and February 18th. So that's like this week, said Xu Yahua, the transport ministry official. So we are on the precipice of potentially seeing this thing go to the next phase. Like I said, I don't see this thing plateauing. As a matter of fact, I feel like we have just fought the initial battle. Forces now understand each other a little bit, and they're about to go into phase 2 as people start to become a little bit more comfortable, maybe too comfortable inside China, open themselves up to potential infection. There is still no treatment for it that has proved to be broadly efficient. Whatever treatments there are still in testing, and so we have a long road to sow. And with people returning to work after the Chinese New Year, we have an interesting opportunity for tragedy. I've said this to my friends a couple of times, the fact that this thing coming during Chinese New Year has been sort of a lulling of the urgency, because it happened just before Chinese New Year started, and everybody that does business in China and everybody that China works with knows that during Chinese New Year, you don't do anything for 2 or 3 weeks. Businesses are shut down, people aren't working, there's no way you're going to get your goods, so everybody understands that. And by this virus sort of penetrating during this time, nobody really took it as seriously as they should, because they were saying, well, China's shut down, they've got this virus thing, but we don't really concern ourselves with China during this period of time anyway because they have Chinese New Year. If this might have happened in the middle of a busy Chinese period of time where they're working and they're making products, and suddenly all the assembly lines shut down in the middle of processing, and all of a sudden things grind to a halt, and there's sickness and there's viruses being spread and all this news, I think that the global community would be like, holy shit, what the hell is going on? But because it happened during Chinese New Year, we've kind of like, well, and now after Chinese, oh, they're just starting up a little bit late. And so I feel like we're a little bit naive to the urgency, and I hope that with these new CT tests confirming cases that people are going to get treated. One treated person is one less person that's going to give it to other people. The more people you diagnose, the more people you treat, the better. I'm not going to touch on the process of these treatments, and with the emergence of this 24-day incubation period and the opportunity for somebody to get reinfected halfway through, the videos I see of people being put in gymnasiums without separation, being lumped together, all the infected together, I feel like infected people could reinfect and reinfect and reinfect each other, and this thing could be just continually growing without complete isolation of individuals. Like, for example, me and my family, we are completely isolated. We are waiting these 14 days at the end. If none of us are exhibiting symptoms at the end of this 14 days, we're good to go. But if you were to bring another sick person to this house, potentially, and let's just say one of us was infected, but not showing it yet, it would reset our clock and we would go another potentially 14 days. So, or 14 days is like the longest period of time. It's typically 3 days. But we're just saying that the opportunity to reset the clock here as far as the disease goes is extremely dangerous, in my thoughts. I'm not a scientist, but I feel like that could be a real problem. Okay, that's about it. You know, this thing hit yesterday, and I was sort of flipping out about the numbers. Why is this happening? What's happening? My wife was telling me some things that she had heard from inside China. She showed me an image of like a verbiage that she was like, this is kind of China's thought on this whole thing. They're going to move in all of these new people. And so when they move in all these new people, they're going to make sure that, that they get the numbers right this time. And they're going to reset the clock, reset all the numbers. It might be shocking, but it's important to get the numbers straight when they move in all of these new officials. To me, I don't know, it just didn't hold up too much water. A lot of these officials came in because the numbers were high. It's not like the officials came in and then changed numbers. The numbers changed, and then they brought the officials in, at least the two major officials. So to me, there's a timeline incongruity. I'm just curious to see the next few days play out. I'm not going to make this video any longer. This is quite long as it stands, but let me know what you think. I know that there's going to be a ton of conspiratorial comments, but I think that this was an interesting day in the saga of the COVID-19 coronavirus. And let's hope that there's not a lot of days like this where there's going to be a huge reset. The potential is there, though, and so we need to be prepared for it. As for me personally, we are just chilling out here at the house. Interesting moment, I was looking at the Johns Hopkins data on the website, and Eva came by, my daughter, and she was looking at it from a completely different perspective. So I'll leave you with a little bit of that conversation that you can see, and the innocence of a child, you know, is sometimes something that you wish you had, because it sure softens a blow when you know some more facts. So anyways, take it easy. Have a good one. I will catch you later. In the future episode, I have my friend Matt, who is giving blood in China to help people and the medical community there, which is great. I want to share that story. We have some tips and tricks on people that are doing different things to protect themselves from the virus in China. We have my friend who had his UPS package of masks that he had sent to China for some family and friends intercepted by delivery people and then ransacked, which is a horrible thing. I think we need to know about that. And yeah, I'd like to talk about a few different things. So let me know if there's anything you'd like to know. I hope you all have a great day. I'm going to edit this thing, have it up today. Jayoe, if you can leave a comment, share this with anybody that you'd like. Bye guys, Jayoe, and I'll catch you next time. What are you doing, honey? What is that?
It's a crack.
Yeah?
Yes?
What is that?
I don't know.
What color are those spots? What color are the dots, baby? You want to see where Da Baba and Da Mama are?
Mm-hmm.
They are right here. Right here.
Where are we house? Here?
Your house is right there.
My house by her. In here.
No, you're Shaoxing, honey. That's Ningbo right there. That's our house.
No, that's the mama house.
Yes, that's Da Mama's house. It's funny. Innocence of a kid. She has no idea, but she's looking at a map of the recording of such horrible things happening.
We live in here. T-shirt place.
The t-shirt place? What do you mean?
T-shirt place is over here. Yes? Yes? And the Japan is over here. Yes?
That's not Japan, honey. You want to see Japan? That's Japan, right here. This is China.
What?
Yeah, that's China, honey.
I don't know China.
You don't know China. China is your China.
Yay!
Yeah, you are China and American, baby.